Empty restaurants and bars, no museums, no theatres. These images are actually from the first wave of the pandemic, but in November, Germans will have to get used to them again. As coronavirus cases rise, Chancellor Merkel announced new restrictions. The main difference this time is that schools and shops will remain open. Many businesses will receive economic support. On Thursday, Merkel defended the new policy in a key speech before the German parliament. The measures we now have to take are appropriate, necessary and proportionate. In particular, there is no milder means than consistently reducing contact to stop and reverse the infection process and bring it to a manageable level. Merkel was constantly interrupted. And the parliament speaker saw himself forced to call for order. The biggest opposition party in the Bundestag, the far-right AfD, was quick to slam the measures. We consider the paralysis of the cultural industry, the hospitality industry, and practically the entire social life, as announced by Mrs. Merkel, to be excessive and inappropriate. Now, one of the big questions is whether citizens will actually comply with these new measures. The government has enjoyed high levels of support, but criticism is on the rise, and there's also an evident coronavirus fatigue.
I'd like to welcome now Professor Peter Kremsner from the University Hospital in Tübingen, where he's working on developing a vaccine. Professor Kremsner, a very warm welcome. Great to have you here with us. What progress are you making with developing the vaccine?
Good afternoon. Well, we are progressing rapidly as we speak. I've just vaccinated 2 more persons in the last 2 hours. And we are in the verge of sort of finishing recruitment in our phase 1 program. The phase 2 of this mRNA vaccine program has already started a month ago, and we are aiming to start the licensure study, the phase 3 program, by November this year. So we are progressing very well.
So you are very optimistic, I gather from your answer. When do you think a vaccine will become available?
Well, I think in general a vaccine in the European Union will become available in winter. Whether this is ours, the one developed by CureVac and by our team, we don't know. But certainly there are also other pretenders. So I'm quite convinced that at least one, if not several vaccines will be already licensed, at least getting preliminary license by the European Medicines Agency in the coming winter. And this is very hopeful, and we need to have more than one vaccine because otherwise the price may be too high.
Right, and also, do you expect to have enough availability to cover so many people as well?
Absolutely. Depending on the vaccine, it may be a shortage if it's a vaccine which is not so easily to produce. For the mRNA vaccine by CureVac, it will be rather easy to produce it in high amounts. Mm-hmm. For others, it may be more complicated. So we need more.
We definitely need more, that's for sure. Will, as you know, in the meantime, we are facing a lockdown light here. But if things don't improve by mid-November, maybe even more harsher restrictions will be implemented in this country and already across Europe. What do you feel about that? Is that helpful?
Well, it is certainly helpful for the pandemic, to fight the pandemic. The control measures are very good. However, if we would like to have them working very well, we would need to be even harsher than it is done now. If we think, even myself or my dear wife and my children, that we want to go to the opera, for instance, or to the football pitch, etc., I don't want to have that. So this is the compromise. We need it. We have in mind always, and the politicians certainly also. I would not like to be position at this stage at the moment, because there is so much you can criticize. And I'm criticizing, for instance, that the young people are going to school, but on the other hand, it is forbidden that they meet and play football. This is nonsense, of course. But in the end, we need to restrict the daily interactions as much as possible to, at least, get rid of this wave which is upcoming.
Professor, I'm told actually I've run out of time, but I'm going to squeeze this final question in there. Are you worried by the amount of people who say they won't take a vaccine when there is one?
I think this is still a minority, and I'm sure that at least 60 or 70% will be available for a vaccine and a shot, and this is what we probably need to have a good immunity overall in the population.
All right, Professor Peter Kremsner from the University Hospital in Tübingen. Sir, thank you very much, and we wish you continued success.
Thank you.
Well, France will be seeing a much stricter lockdown. President Emmanuel Macron has been laying out new guidelines for that country's shops, bars, and restaurants there will be closing. That's starting tomorrow, Friday. Travel between French regions will no longer be possible. Macron announced the restrictions a day after France reported some 500 deaths in just 24 hours. Let's get more now from Paris and our DW correspondent there, Lisa Lois. Good morning to you, Lisa. How has the nation been reacting to the news of a new lockdown for the country?
Well, I think you couldn't say they're happy, but many people have been saying really sick of this. Really, the government should have acted earlier, especially opposition forces have been saying, the government should have prepared for the situations. The figures were rising since September at the very latest, and they could have imposed more measures earlier so that now we wouldn't have to face such a strict lockdown. And people here in Paris, many people have been leaving Paris since yesterday to go to the countryside and spend the lockdown there at friends' houses or in their own houses in the countryside. So people are not happy. However, a recent poll is showing that 9 out of 10 people will respect the new rules, so it doesn't look like there will be any uprisings against them or anything like that.
The number of infections, though, has been increasing. It's been surging for weeks now. Do we know what's behind that, and why didn't the government act earlier to contain the pandemic?
Well, it's very difficult to say. What we do know that there are many clusters at work and at school and university. The government has now decided to close universities, and they had imposed restrictions earlier. They had closed bars in certain areas, restricted restaurants, imposed curfews in about 2/3 of the country lately. But all these measures weren't enough. The government is saying, we were surprised by the sudden rise in infection numbers over the past couple of weeks or so. Virologists say, however, that with colder temperatures, that was kind of predictable, and that the government should have acted earlier, really.
Is Paris putting together an aid package to help the kind of businesses that are going to be affected, like we're seeing here in Germany, bars, restaurants, gyms? Is there going to be financial aid for these small business owners?
Well, absolutely. They will prolong many schemes like the furlough scheme here. There will be subsidies and government loans for those businesses. The exact details will still be announced probably later in the day, but the government has said that they want to do what they can to support all those businesses. Self-employed workers, for example, in poorer areas will get an extraordinary subsidy of 1,500 euros, and the government will also take over losses of up to 10,000 euros per month. But as I said, the government will announce the exact details later in the day today.
Okay, we'll be looking forward to those details from Paris. Lisa Lois, for now, thanks so very much.
Every weekend, Madrid police have been knocking on hundreds of doors to shut down illegal parties. Madrid allows meetings of up to 6 people who are not related, but police have broken up parties of more than 200. Joaquin is a business student in Madrid. He only wants to speak briefly and anonymously, as he regularly goes to such parties. He himself recently helped organize one. We just rented a place so we could drink and smoke inside. A few visitors even wore masks, but that didn't last long. Honestly, young people's biggest fear is having to pay a fine. That's why the places need to be well insulated, so the neighbors and the police won't detect anything. Joaquin and his friends seem unfazed by the statistics. A third of Spaniards become infected with the coronavirus at private parties. 200 illegal parties were broken up in Madrid last week alone. Police Chief Javier Fernandez is especially troubled by the new business model being developed here. Bars that are actually supposed to be closed certainly do take money in exchange for letting people in. There's a clear economic incentive for it. Apart from that, we have discovered private homes that were charging entrance fees right at the front door. This isn't just about a few friends meeting up. Psychiatrist Diego Figuera is calling for more empathy with the young people, even if he supports strictly abiding by the hygiene measures. Experts are starting to acknowledge the consequences of such drastic restrictions on young people's social lives. Right now, we are finding out that young people's mental health problems have increased dramatically as a result of this spring's lockdown. Suicides have increased by 22% so far, and attempted suicides have even increased by 35%. On top of that, there's been a major increase in the consumption of alcohol and psychoactive drugs. Young Spaniards are now confronted with new rules. All bars in Madrid must close at 11 p.m. starting this week, and curfew begins at midnight.
Half a year of the pandemic has massively affected the quality of life of young people all over the world. At the same time, experts keep emphasizing how dangerous partying can be in the current situation. Spain's chief epidemiologist even directly turned to Spain's youth and asked them to refrain from parties at the moment.
Even so, business student Joaquin doesn't want to be forbidden from partying. He says he can decide for himself what risk he's willing to tolerate, even if it means partying in private homes until 6 a.m. for the duration of the curfew.
The pandemic has affected all walks of life here in Europe. For young people, it's changing the meaning of, well, youth. While parties are mainly out, meetings with friends are strictly regulated, sports tournaments and class trips, well, they're all cancelled. Here's a closer look now at how the pandemic is reshaping life for Europe's young.
Lucia is 16 years old and lives in Sevilla, Spain. Her life has changed dramatically. At her school, in-person learning only takes place in small groups. The rest is online.
We used to meet more people. Now I just go around in a small group of friends. We used to go to the movies, but we don't do it now because of the risk. We used to go everywhere by bus. Now I only walk. Everything has changed. Everything's harder now.
Still, she says she understands why the rules are in place.
We do have grandparents and older people in the family. That's why I don't think the measures go too far. They're for something good.
Nat lives in the Polish capital, Warsaw. The pandemic's constant stress and worry, as well as social isolation, have taken a toll.
I suddenly had symptoms of anxiety disorders and developed tics. Acquaintances have told me that they have psychological problems and anxiety from the constant uncertainty.
Politics are a big interest. Last summer's presidential race saw Nat get involved in LGBT activism. That helped.
My sense of activism was reawoken because of the pandemic, and that's a great thing. There were presidential elections during the pandemic, and there was so much hatred directed at LGBT people.
Tara is 18 and lives in London and is also finishing school. She wants to go to a highly selective theatre academy. She's dreading the fall and winter months.
We can't just meet each other outside anymore because it's so much colder, and we can't go to each other's houses, and I think that I really miss seeing my friends and going to parties. And I know it sounds like, ooh, but I'm not going to be able to see my granny at Christmas, and my family aren't going to be able to go and visit her, and she's going to be on her own. And so it's just all these different things that just make it such a rubbish thing to deal with.
She says the government doesn't have young people's mental health in mind when it makes decisions.
As you know, the government just thought, right, let's just shut everything off that makes young people happy and gives them like things to enjoy and things to like escape from their lives from, you know, like parties and just have a bit of fun, which is what like makes being, I think, a young person so fun.
Fun, parties, adventures, simply sitting in a full classroom. It's all out of reach during this time of isolation, with no end in sight yet for young people.
To Australia now, where the state of Victoria has reported just one new coronavirus infection in the last 24 hours, a day after a 4-month lockdown was lifted in the state capital, Melbourne. The city has been the epicentre of the pandemic in Australia. The shutdown has been one of the world's longest, and some took the opportunity to celebrate their new freedoms in one of Melbourne's bars. Some restrictions are still in place, though. A travel limit of 25 kilometres is still in effect for people in the city, and masks must still be worn outdoors. So are there any lessons here for countries in Europe that are scrambling to regain control of the pandemic, like Germany, for example? We are now joined by Professor Adrian Esterman, a professor of biostatistics and epidemiology at the University of South Australia. And I think we're having technical problems with that line to Australia. No, here we are. Professor Esterman, thanks for joining us. How confident are you that numbers can be kept low in Australia?
I'm very confident. It's estimated there's only a 3% chance that will go into a third wave. We have, as you already pointed out, very low daily case numbers. We have 2,600 contact tracers with only a population of 6 million in Victoria, which is a very, very big ratio. And with the number of cases we have, that's ample to make sure that everything's in control. On top of that, the number of cases of unknown contact, we call them mystery cases here, are also extremely low. So I think we're fairly confident that we now have it under control.
There were countries here in Europe that were handling the pandemic well in the beginning, but they're now, like Germany, for example, experiencing soaring numbers. What do you think went wrong here?
Probably opening up too early. I understand in a lot of Europe there was summer season, people wanted to go out and go on holidays and party, and it's just got out of control.
So what's your advice then to get the situation back under control here?
Well, one of the reasons why Australia has been so successful is that each state and territory in Australia has got its own Department of Health and obviously its own Premier. And the first thing the Australian government did was to form a national cabinet. So all the heads of the different states and territories got together with the federal government and formed a national cabinet. Think of it as a war cabinet. On top of that, all of the chief medical officers of each state and territory got together and formed a committee. And those two worked hand in hand. Now, I don't know whether Germany has done the same thing, but if they haven't, that would be the first thing I would do everything at a national level. I think the second thing is that... Sorry?
Continue, please, sorry.
Yeah, so the second thing is that at the moment you have far too many cases for your contact tracers to be able to handle it. So everything's got out of control. So the first thing to do is to try and reduce the number of daily cases so that your contact tracers can then manage. And I'm talking about hundreds of cases rather than thousands. And so your current restrictions you're putting on, your current partial lockdown, will probably do the trick and enable the numbers to get low enough for your contact tracers to get a hold of it. So I think that's a good thing that you're doing, although I don't know whether 1 month will be long enough. But certainly it's a good step in the right direction. The other really key important thing is testing. So in Victoria yesterday, there were 24,000 tests, which is a huge number. So you have to keep testing going. And the final thing is that if you have open borders with other countries, you'll just keep importing more and more cases. So if I was in charge of Germany, I'd close my borders and then try and get the numbers down really low and keep them low.
Well, in your view, briefly, what countries have managed the pandemic most effectively so far, aside from Australia?
Well, you've got South Korea, Vietnam in particular has done a brilliant job. So mainly Asian countries have done extremely well. A number of countries reporting 0 cases, but I'm not sure I'd trust their statistics. But certainly countries like Singapore, South Korea, New Zealand have all done extremely well.
Professor Adrian Esterman from the University of South Australia, thank you very much.
You're very welcome, Gerhard.
All right, let's tell you now some more about the other global developments in the pandemic. India has now passed 8 million confirmed cases. It's the second highest number after the United States, but India has one of the world's lowest death rates. Iran has reported a record death toll for a second straight day. It's the worst hit country in the Middle East. And Taiwan has passed 200 days without any domestic transmissions of COVID-19. Officials are hailing the achievement as a success story.